Welcome to Doctor Health Hub, where every episode begins with a doctor tip you can trust. Today we're talking about something many families in our region know well, Beta-Thalassemia. But we're not only reviewing the condition, we're discussing a new treatment that has changed the future for many patients. Before we talk about gene therapy, let's make sure the basics are clear. Doctor, when parents ask, what exactly is thalassemia, how do you explain it simply?
I tell them thalassemia is a blood condition you're born with. The genes that make hemoglobin don't work properly. And hemoglobin is what carries oxygen. When it doesn't work well, the body can't make enough healthy red blood cells, and that causes anemia.
And it's inherited, not something they catch later.
Exactly. It comes from parents to children. It's not caused by food or lifestyle. We see it more often in Southeast Asia, South Asia, the Middle East, Mediterranean regions, and parts of Africa, but it can appear anywhere.
When children have the severe type, what does daily life look like?
If it's the transfusion-dependent type, the body can't make enough hemoglobin to stay healthy. These patients need transfusions every 2 to 5 weeks. That becomes part of family life. School, work, trips, everything revolves around transfusion dates.
Yes, families plan their entire schedule around it.
And after years of transfusions, iron builds up in the body. Iron overload affects the heart, liver, and hormones, so families are managing 2 things, raising hemoglobin and removing iron.
Which is why for a long time treatment felt like transfuse, chelate, repeat.
That's right. For decades, there wasn't another option. But in the last few years, something major changed. 2 gene therapies were developed, tested, and officially approved by the United States FDA. The first was approved in 2022. The second was approved in 2024 for patients 12 and up.
This is where families really start paying attention, because this isn't just another adjustment to treatment, it's a completely different path.
It is. With gene therapy, we're helping the patient's own body make healthy red blood cells. We collect their stem cells, correct them in the lab, and then return them. After that, many patients start producing enough hemoglobin on their own.
Families always ask the biggest question first. Does it really work?
Yes. In the FDA studies, dozens of transfusion-dependent patients were treated, and about 90% became free from regular transfusions. Most still remain transfusion-independent after years of follow-up. That's why this treatment is considered a major breakthrough.
And if you know thalassemia, you know what that number means. It means kids can go to school without missing weeks. Adults can work without planning around transfusion dates. It means less worry, less hospital time, and more normal life.
Exactly. It doesn't erase the condition completely, but it shifts the future in a real, meaningful way.
Let's walk through the process so families know what to expect in real-world steps.
The treatment happens in stages. First is evaluation, heart MRI, liver iron scan, hormone tests, infection screening, and transfusion history. Second is stem cell collection. Third is the laboratory step, usually 4 to 8 weeks. Fourth is conditioning chemotherapy. Fifth is the infusion of the corrected cells. Then comes recovery, where the immune system rebuilds.
And how long does the entire journey take?
Around 3 to 6 months from start to stable recovery. The hospital stay is usually 3 to 6 weeks, depending on how fast blood counts recover.
Families often ask when follow-up visits happen after going home.
Follow-up is close in the beginning. Weekly visits for the first 1 to 2 months, monthly visits for the first year, and after that, yearly monitoring for long-term safety.
What complications should families understand clearly?
Most early complications come from chemotherapy, infections, fever, mouth sores, nausea, and low blood counts. Long-term concerns include possible infertility, hormone changes, slow improvement of old iron overload, and a very small risk of bone marrow problems. That's why we follow carefully.
Before treatment, what should families do?
Keep regular transfusions, stay on iron chelation, eat well and hydrate. Complete all tests, update vaccines if approved, arrange family support, and ask questions until everything is clear.
And what should they avoid?
Don't stop medicines yourself. Don't skip transfusions. Don't use herbs without approval. Avoid infection exposure. And don't rush the decision.
How about after treatment?
Infection protection becomes very important. Attend all follow-up visits, eat safe foods, report fever immediately, return to activity slowly, monitor iron and hormones over time.
And the don'ts after treatment?
Avoid raw food early on. Avoid skipping follow-up. Avoid heavy exercise too soon. Avoid live vaccines unless approved. Avoid unapproved supplements. And don't donate blood.
Families often feel nervous. What do you say to help them feel grounded?
I tell them it's normal to feel nervous. But I also tell them that for many patients, gene therapy offers a real chance to live without regular transfusions. It's not a magic cure, but it's proven, it's real, and it can truly change their future.
That's the key. Not blind hope, but evidence-based hope.
Exactly.
Let's close with a short summary. Thalassemia is an inherited condition where the body can't make enough healthy hemoglobin. Severe cases need regular transfusions. Gene therapy was FDA approved in 2022 and 2024. Around 90% of treated patients became transfusion-free. The treatment includes evaluation, stem cell collection, lab correction, chemotherapy, infusion, and recovery. And for many families, this treatment truly changes daily life.
Well summarized. And, as always, we walk with families through every step. Thank you for joining us on Dr. Health Hub. And remember, your health is your wealth. Stay tuned for the next doctor tip you can trust.